inability to make decisions, even everyday decisions like what to wear, without the advice and reassurance of others. Avoidance of adult responsibility, tendency to be naive and to fantasize. Causes. Although the exact cause of DPD is not known, it most likely involves a combination disorder. The person responds to fears of abandonment with feelings of rage and emptiness. With DPD, the person responds to the fear with submissiveness. To specifically diagnose personality disorders, the doctor might use various diagnostic tests to rule out physical illness as the cause of the symptoms. If the doctor finds no physical reason for the symptoms, he or she might refer the person to a psychiatrist, psychologist, or other healthcare professional trained to diagnose and treat mental illnesses. Psychiatrists and psychologists use specially designed interview and assessment tools to evaluate a person for a personality disorder. As is the case with many personality disorders, people with DPD generally do not seek treatment for the disorder itself, and they are no longer able to cope. People with DPD are prone to developing depression or anxiety, symptoms that might prompt the individual to seek help. Psychotherapy, a type of counseling, is the main method of treatment for DPD. The goal of therapy is to help the person with DPD become more active and independent, and to learn to form healthy relationships. Short-term therapy with specific goals is preferred when the focus is on managing behaviors that interfere with functioning. It is often useful for the therapist and patient together to pay attention to the role of therapist in or used to treat people with DPD who also suffer from related problems such as depression or anxiety. However, medication therapy in itself does not use them inappropriately or abuse certain prescription drugs. What are the complications of DPD? People with DPD are at risk for depression, anxiety disorders, and phobias, as well as substance abuse. They are also at risk for being abused because they may find themselves willing to do virtually anything to maintain the relationship with a dominant partner or person of authority. With psychotherapy, counseling, many people with DPD can learn how to make more independent choices in their lives. Can DPD be prevented? Although prevention of the disorder might not be